Hi Kim, my name is Jenny. We're going to be going over some health questions before we do your cranial assessment, okay?
Okay.
All right, so just a few questions. What can you tell me about your past and current medical history? Do you have any health conditions that you've been diagnosed with?
No, not currently. I actually don't have much of a significant medical history.
What kind of medical history runs in your family?
My mother has high blood pressure and high cholesterol. My grandmother had colon cancer, breast cancer, and diabetes. And there's also heart disease on my father's side.
Okay. And do you eat a well-balanced diet?
Yes, for the most part.
All right. Do you have any concerns about being able to afford or purchase food?
No, no, it's not.
So your income is sufficient?
Yes, my income is sufficient.
And with that, you don't need assistance with meal preparation or resources to access meals being delivered to you?
No, I don't need any of those services.
Okay. How's your appetite been lately? Any unexplained weight loss?
No, none whatsoever.
Okay. And what kind of medications do you take that are prescribed or over the counter?
I don't take any prescribed medications. I do take over-the-counter daily vitamins and a fiber supplement.
So if it's fiber and multivitamin?
Yes.
And your doctor is aware that you're taking these?
Yes.
Are you currently experiencing any concerns such as frequent headaches, nausea, pain, blurred vision, or bowel or bladder concerns?
No, not at this time.
No headaches or anything?
No.
Okay. And what kind of surgeries have you ever had?
I have had 2 C-sections, and I've had my tonsils and wisdom teeth removed.
And how old were you when you had your tonsils and wisdom teeth?
I was a young child with my tonsils, I think maybe around 7 or 8.
Okay.
My wisdom teeth, I was 17.
And with your C-sections, do you remember what years they were?
2004 and 2008.
Okay. And were these surgeries performed locally or out of state?
They were locally.
And how would you describe your current level of activity?
I'm very active. I get a lot of walking in with my job.
You're a nurse, correct?
Yes,
So
I
you
am.
do lots of walking.
Lots of walking.
What type of daily activities and or exercise do you participate in? You said walking.
I do a lot of walking, and I occasionally do my elliptical.
Very good. So lots of cardio. And would you please describe any stairs that you have in your home and if what kind of you don't use any assistive devices to ambulate?
No, I do not. I just have stairs at the entrances to my home.
Okay. And how many stairs would you say at the entrance?
About 5 or 6.
Okay. Now we're going to get into sleep. How many hours of sleep do you normally get each night?
I'd say an average of about 6 hours of sleep a night.
Okay. Do you feel unusually tired lately or more than normal?
Not more than normal now.
Okay. And who do you live with?
I live with my husband and 2 children.
Do you get lots of visits from family members and friends or just occasionally?
Occasionally.
And are you a caregiver to anyone?
No, not at this time.
So you function independently as well?
Yes.
And you live in a single family home or an apartment?
A single family home is 1 story.
And I can tell that your primary language is English.
Yes.
And who else would you like involved in your care?
My husband.
Okay. And who are your support people?
Mainly my husband and my family.
Okay. And do you identify with any particular cultural group?
Caucasian.
And what provides you with strength and hope?
Just motivation to do well for my family.
Okay, we are almost done. And while you're here today, would you like a visit from one of our clergy members?
No, thank you.
Okay, and getting into a little bit about your workplace. Are there any safety hazards at home or at work that would pose a threat to your physical safety?
Not so much. I do work in a hospital, so we're just exposed to the public.
Do you travel with your job?
Occasionally, yes, I do.
So there's some driving involved?
Yes.
Are there any repairs that are needed to keep your environment at work or home safe?
No, not at this time.
Okay. And what level of education do you have?
I have an associate's degree, and I'm working on my bachelor's.
Very good. What do you do for a living currently or in the past?
I'm a nurse now, and I own a cleaning company before.
So you were self-employed for a long time?
Yes.
What's your best level of learning as far as like, do you use visual, assisted, written material, or demonstration?
Usually a combination of all the above.
A little bit of everything. You're kind of a hands-on person.
Yes.
Do you feel safe at home?
Yes, I do.
Is there anyone that around you that you would feel unsafe around?
No, not this time.
And does anyone around you or yourself participate in illegal activities?
No.
And do you consume alcohol or illegal drugs?
No, I do not.
And what about caffeine?
Always.
Always. So how many cups of coffee or soda do you think you would have a day?
I'd say an average of 3, maybe 4.
3 cups of coffee. Not a big soda drinker.
No, sometimes I have tea.
Do you ever have thoughts of self-harm or harm to others?
No.
Have you ever had a plan to end your life or went to bed wishing that you wouldn't wake up in the morning?
No, never.
What kind of activities do you like to do that make you happy?
Hang out with my kids. Go for walks and read.
And do you have any questions for me at this point?
No, not today.
Okay, thank you.